Thank
so
you.
We want to talk about aging gracefully and taking care of our elderly, because the truth is that at some point we're all going to grow old. And it's not just about us, it's about our parents and our loved ones. So let me first of all ask you, what do you do as a geriatrician? I've never really heard that term before. I'd like to know what exactly you do and how do you help people to live better lives?
Okay. So first of all, a geriatrician is a physician that is trained in looking after elderly people. Okay. I trained in the UK because here in Nigeria, when I was here as a medical student, I left after my house jobs. There was no geriatric medicine. And the first time I actually heard of geriatric medicine was when I got to the UK in 1991. And I got there, and my first job was in geriatric medicine as a junior doctor, and I absolutely loved it. And the reason why it's so important to have geriatricians is because as people age, all of us, our bodies change. And, you know, physicians, you have different specialties in different physician specialties like cardiology that focus on the heart, you know, endocrinology, they focus on things like diabetes, thyroid problems. You have chest pulmonologists. We're all physicians. Yeah. The geriatricians deal with the peculiar problems of aging and the elderly. So there are two options to life, I always say. So I tell people there are two options to life. It's either you age or you die. So what you want to do is you want to age well. We're all aging. You know, so I'm 51, we're all getting older. And as you get older, things start to deteriorate. So aging actually starts at 30.
So we're aging now.
You have aged. We're all aging. You have aged. You haven't aged. You look, I mean, you look fantastic. So, you know, aging starts at 30. So up till that point, it's growth. You know, the body grows, the cells grow. By the time you get to 30, things now start to deteriorate. And there are two factors that, you know, that affect this. So it's either your genes and what you do to yourself. So your genes make up like 30% of how you age. The other 70% is made up by what you do.
Right. There are people watching TV right now, and they want to know how we don't get to this point where they are needing this kind of help. So I want you to, let's reverse a bit on how do we age gracefully? How do we age in a healthy way so that we don't have to go through this? That even if my children travel abroad, I can be strong enough to take care of myself. I would like you to help us on those few steps.
Okay. So I think when you get to a certain age, I'll say 30. Although many of us, I don't know, you all look so good, so I don't know how old you are. I'm 51.
All at least 30.
But you're all at least 30. So when you get to a certain age, the first thing you need to do is, for me, the number one remedy to aging is exercise, moving. Exercise, moving. I don't know how you ladies do it because you're here in the studio so early in the morning. I've watched a few of your shows. I also get up early. You get up early in the morning, you do your exercises, 30 minutes a day, at least. If you can get in your 10,000 steps, let's just say you do that in 30 minutes. Yes, try. You can start, yes. So, I mean, I have a patient now. He'd never exercised. He's 83. He'd never exercised. He came from Ekiti to see me. And he'd never done anything. And I said to him, I said, okay, so now we need to get set 30 minutes. I said, 30 minutes, sir. So I was there when he did 10 minutes. Went for his first walk, 10 minutes. Got his grandchildren. I was like, Grandpa must walk maybe twice a day. He went again, 15 minutes. So, you know, they've got to start from somewhere. The first time, 5 minutes, he was panting. He couldn't do it.
So it's never too late, you're saying?
It's never too... 83.
Okay, so there are lots of food that they usually say, take off your menu. And many people watching always try to guess which is right or which is wrong. So which would you say take off?
Sugar.
Like refined sugar?
Any sugar.
Only they like soft drinks.
Sugar.
Yeah. Sugar out. Okay?
Sugar out.
What about beef?
Sugar is your number one anti-aging, so your number one aging agent.
Oh, wow.
Number one. I say that, but I still have a tiny bit of sugar because it's tough.
It's quite tough.
Because we grew up with sugar.
Yeah.
We grew up with sugar.
When you say sugar, like, I know the added sugar, but other
The added sugar and any other kind of sugar, as much sugar. No, that's natural. That's fruits.
Okay.
You're supposed to have your fruit and veg.
Yeah, right.
But, you know, adding sugar, sugary drinks, even orange juice, all those extra sugars. Yes. I believe in having everything in moderation, everything, seriously. I wouldn't say cut out meat. I wouldn't say cut out, you know, oil, maybe palm oil. You can indulge once in a month or something.
Palm oil is healthier than regular.
That's what I was taught until we now found that it actually clogs the arteries. I know.
Okay,
So I believe that when you get to a certain age, we should allow you a bit of an indulgence. I mean it, and I have seen lots of miserable elderly people.
What would be the essential test for those who can't afford a specialist but would be going to the general hospitals? What should they be asking for?
So the first, let me list it. So number one, ask them to check your blood pressure. Want to know your blood pressure? That's number one. If the blood pressure is high when they get there, it might be anxiety because they're saying, Ejo, can you check my blood pressure? Or is she me? Before you leave the center, can you check it again? So blood pressure, number one. Number two, if you've got the means, then really we should be doing the diabetes blood tests and the cholesterol blood tests.
Okay.
If you've got the means. And for anybody, it's not that expensive. At least once a year from 65, you should check that. This one I'm going to say because I've been asked this by some GPs recently. Thyroid function. Thyroid function. Now, that is an expensive blood test here in Nigeria. It's an expensive blood test anywhere in the world. But I believe that it is one of the most essential blood tests that everybody should check at least once in 2 to 3 years from age 65 is your thyroid blood test. Because if that is defective and it is left unchecked, dementia is looming. So, you know, that can't remember, wandering around, suddenly became aggressive, became paranoid, they're calling them witches and all of that. That is what the end game.
Wow.
And that is also, yes, if the thyroid is not working properly and it is left unchecked for 10 years, that's where you're heading.
Wow.